特约汉健商队所主办的1年1度的 Annual State Crochet and Home Nursing Competition。这次的比赛呢，有6间学校和14队队伍参加比赛。这次的比赛分成3个部分，也就是步操、护理以及急救。
1, 2。
Selamat pagi, Cik. Saya Erotan dari kumpulan NC1 telah siap diuji, Cik. Terima kasih, Cik.
这次活动主要目的是为了提供护理和急救的知识，并提供互相交流和观摩的平台。
We should actually try our best to have more opportunities to do this.
You all are becoming the future nurses.
Program kerjasama dan pihak Jabatan Pendidikan Negeri Penang sangat mengalu-alukan.
Hi there, welcome back to the first aid class. It's me again, Gaw. I believe you have learned a lot from the previous chapter. And today, we are going to start a new chapter, which is foreign object and also poisoning. After this chapter, you are going to learn how to manage if foreign object fall into our eyes, nose and ears, and how poisoning affect our body and how poison go into our body. And also lastly, bite and also stink. Without further delay, let's go. Before we start talk about how foreign object affect our body, let us understand what is foreign object. Foreign object means something that not originally from our body. It come into our body maybe through a wound or opening of our skin. And foreign object may cause a little bit distressing, but will not harm or cause life-threatening injuries. The most common foreign object is called a splinter. Splinter can be from a sharp wood, metal, or even a piece of glass. So splinter can cause infections to our body because they are from something that is not clean. To remove the splinter, first, gently clean the area around the splinter with soap and warm water. Use a tweezer to hold the splinter and draw out the splinter in a straight line at the same angle that went into the skin. To minimize the risk of infections, carefully squeeze the wound to encourage a little bleeding, because this will help to flush out any remaining dirt.
clean and dry the wound again with soap and warm water, and then cover it with a dressing to prevent infections. Remember, if a splinter is embedded or difficult to pull out, immediately seek for medical help.
So we all understand that foreign object is something that not originally from our human body. So foreign object may also affect our eyes too. So a little sand, loose eyelash, contact lens may also become a piece of foreign object that float on our eyes. So these can be removed easily by using a running water. However, do not attempt to remove any object that stick on our eyes and also penetrate our eyeball, because this will cause more damage to our eyes. If you see someone suffering foreign objects in their eyes, advise them not to rub their eyes, because this will cause more injuries to the eyeball.
A casualty that had foreign object in their eyes will have these signs and symptoms: blurred visions, pain or discomfort inside their eyes. The casualty may also have redness and watering of the eyes. Foreign object in the eyes can be easily removed by running water. First, you need to ask the casualty to sit and face upward. Gently spread his eyelids with your thumb or fingers, and then locate the foreign object. Once you can see the foreign object on the white of the eyes, remember, put a towel around the casualty's shoulder. Wash it out by pouring clean water from a glass or jar, or you may use sterile eye wash to clean the object. Hold his eye open and pour water from the inner corner so that the water will drain on the towel. Try remove the object by using a moist swab or a clean handkerchief. If the object is still intact, advise the casualty not to rub his eye and seek for medical advice immediately.
So next, what will you do if something falls inside our ears? So this is what we call foreign object in the ears. So foreign object in the ears frequently happen on young child, which they try to push something inside their ears just for fun. And they play their toys, they will accidentally fall the object inside their ears too. Or sometimes the tip of cotton bud might also break and left inside our ears. If this situation happens, try not to remove the foreign objects.
Okay.
And send the casualty to hospital. The medical staff will have equipment to remove the objects. Now, the most common foreign object in the ears are insect fly or crawl into our ears. So what will you do if these situations happen?
If a foreign object stuck in the ears, to prevent injuries to the ears, do not try to remove a stuck foreign object yourself. Arrange to take or send the casualty to hospital as soon as possible. We all know that insects can fly or crawl into our ears and trap. To remove a trapped insect, first, support the casualty head with the affected ear facing upward. Then, gently flood the ears with water and the insect should flow out. If this method is failed, seek for medical help immediately. Using a torchlight and shine into our ears is not so effective.
Next, foreign object in the nose. So foreign object in the nose is one of the most dangerous emergency situations happen on young child. Young child like to push a little object into their nose while they're playing the toys. These foreign objects will cause infections and also bleeding internally in the nose. Do not try to remove or digging the foreign object, because this will cause more injuries or push the foreign object further into our airway. How do we know someone suffering from foreign object in the nose? The casualty may tell you difficulty and noisy breathing, and also if the foreign object or the injuries is severe, the nose will start swelling. The most important is, do not try to remove the foreign objects. Ask the casualty to stay calm and stay cool. Bring the casualty to hospital. At the same time, advise the casualty breathe through the mouth in the normal breathing rate. After we understand the management of foreign object came into our human body, now we are going to talk about how to handle if poison affect our body. So poison is a substance, if taken into our human body, will cause temporary or permanent damage to our organs, especially the brain, heart, lung, and also liver. Poison can be separated into two main parts: a man-made poison and poison from the nature. Man-made poison can be chemical, drugs, which these are easily found in our house and also industry. Poison from the nature can be produced by the plant that produce poison, insect or creature that have venom in their body. And this venom will come into our human body through a bite or a sting. Now, let us take a look how poison affect or came into our human body.
How does that poison affect our body? Poison can enter our body in several ways, such as swallow, absorb through the skin, inhale, splash in the eye, and eject through the skin. Swallow poison can include chemical, drug, alcohol, and plant. If someone had swallowed poison, they might have nausea, vomiting, abdominal pain, and decrease of level of responsiveness. What you can do is to call 999 for emergency help. Start CPR if the casualty become unresponsive and not breathing. Remember, always put on PPE to protect yourself. Sometimes, the poison like industrial poison or plant poison may absorb through the skin. The key signs to look for if poison absorbs through the skin are pain, swelling, redness, and itching. The action you should take are: flood the injured under running water for 20 minutes, remove any contaminated clothing, and seek for medical help. Industrial chemical fume from the cleaning chemical or fire can become poison. If someone inhales this poison, they might feel difficulty in breathing, become hypoxia or cyanosis. You need to immediately transfer the casualty to somewhere safe and got plenty of fresh air. Call 999 for emergency help. Poison splash in the eye is commonly happen in industrial and home. Poison like cleaning product, industrial chemical or plant poison may accidentally splash into our eye. The casualty may experience pain, watery eye, and blur vision. Our first aim is to prevent further damage to the eye by flushing the affected eye under running water for 10 minutes. This will help to wash the chemical out. And remember, seek for medical help immediately. Venom from sting and bite or drug can be ejected through the skin. This poison can cause pain, redness, and swelling. Usually these happen around the ejection site. The casualty might become difficulty in breathing, decrease of level of responsiveness, seizure, or sometimes may become anaphylactic shock. For sting or venom, you need to remove the sting and call emergency help. For ejected drugs, what you can do is call 999 for emergency help and monitor the casualty. Start CPR immediately if the casualty becomes unresponsive and not breathing.
Swallow poison can be extremely dangerous. The chemical like bleach or gasoline, these chemicals are easily found in our community. If someone accidentally swallows this chemical, will cause hurt to their digestive systems as well as airway burn, because these chemicals are corrosive and also poisonous. This poison can travel through our bloodstream to our body, even go into our vital organ like our brain. If poison enters to our brain, this will cause more serious injuries, like will lead to seizure and also can become cardiac arrest.
A person that swallows poison may experience these same symptoms: vomiting, or sometimes you may see blood stain in the vomitus, cramping abdominal pain, pain or burning sensation in the abdominal. The casualty may also experience diarrhea. The casualty may sometimes change in level of responsiveness or become seizure. If the person swallows poison, you may see empty chemical container nearby. Before the casualty becomes unconscious, you need to identify the poison. Ask the casualty what he or she has swallowed, how much, and when. Record it down, and these need to pass over to the medical staff. If possible, look for surrounding. Look for any samples of poison. Example, empty container or poisoned plant. Tell the casualty you need to remove contaminated clothing to prevent burn to the skin. If you found chemical burn, flood the injured area under running water for at least 20 minutes. This will help to cool down the burn. Then call 999 for medical help. Provide the call center information of the poison, because this information will assist the medical team to treat the casualty. Monitor and record the casualty vital sign while waiting for help. Keep sample or any vomitus and pass over this sample or any chemical substance that you can find in the surrounding to the medical staff. If the casualty becomes unresponsive, to maintain the airway open, breathing and circulation. Or you can also turn the casualty into recovery position if the casualty is still breathing. If the casualty not breathing, start CPR immediately. Remember, if the casualty lips are burned, give the casualty frequent sips of cold milk or water while waiting for help arrive. Never attempt to induce vomiting. Always put on PPE such as glove, face mask and face shield to protect yourself.
A bite and a sting is the most common factors that bring poison into our human body. A bite from a sharp teeth might cause punctured wound and also damage our body tissues, and these will lead to infections. The viruses such as rabies, HIV and also hepatitis virus that carry in the saliva of the infected animals can transmit to our body through a bite. So any bite that break our human skin require immediate first aid treatment because it is high risk infections.
After bitten by an animal, bleeding is the most common thing to happen. To control bleeding, you need to apply direct pressure over a sterile pad and rise the injured part. Wash the bite wound by water to minimize risk of infections. Rise and support the wound and pat dry with clean gauze swab. Then, cover with a sterile wound dressing and bandages. Arrange to take or send the casualty to hospital to get proper wound care and injections.
After knowing what is a bite, and now we are going to talk about a sting. A sting usually caused by bees, web and hornet. A sting can be very, very painful, but it's usually not so dangerous if we can identify it early. But how do we know whether a person gets stung? A person that gets stung usually can experience pain at the sting site, and it will slowly develop, become redness and swelling around the sting. For example, if the sting is at the mouth or neck, it might become very, very dangerous because swelling will obstruct our airway. This is what we call anaphylactic shock, a severe allergic reaction.
After insect sting, first, you need to reassure the casualty by calm the casualty down. If the sting is visible, brush or scrape it off sideways with the edge of a credit card of your fingernail. Rise the affected part and apply ice pack for at least 10 minutes to minimize swelling. Arrange the casualty to seek for medical advice by calling 999, or you can bring it yourself. Watch for signs of allergic reactions such as wheezing breath sound, redness or itchy skin, because this might be an anaphylactic shock. Do not use tweezer to pull the sting because you could squeeze or eject more poison into the casualty.
After knowing the management of insect sting, and now we are going to introduce you one of the most scariest creature, the snake. The snake can be separated into venomous and non-venomous. and a snake wouldn't often attack someone unless they feel threatened.
I'm still curious. You? Advantage with the eggs, bro.
A snake bite usually not serious, but it is safer to take it seriously by assuming all snake bites are venomous. When a snake bites you, it will eject venom. Venom will go into our bloodstream and follow the blood to the whole body, especially the vital organ, which this will lead to vital organ failure, uncontrolled bleeding. It might also become paralysis. Now, what will you do if someone bitten by a snake?
More than 65% of India's population lives without indoor sanitation. Heading into the night, barefoot, to answer the call of nature is the norm in rural areas and one of the most common causes of snake encounters. Using the figures from the new report and his own decades of field experience, Rom estimates that the Russell's viper could be responsible for half of all fatalities. Many occur in circumstances just like this.
After a snake bite, the casualty will feel pain. Then, redness and swelling will happen afterward. As a first aider, you need to ask the casualty to stay calm. How? By asking the casualty stop running and do not panic. Increasing of heart activities will spread the venom faster and further into our body. Then, move the casualty to somewhere safe, somewhere far away from the snake. This is to keep yourself and the casualty safe. Then, you need to record down the time of the bite. And also, you need to recognize the snake. This is not asking you to find the snake. If you can see the snake, snap a photo by using your phone and pass it to your doctors. This will help the doctors to identify the correct antivenoms. Remember, do not suck the venom out by using your own mouth. Why? Because if your mouth has a wound or ulcer, the venom will go through the wound and get yourself involved in dangerous situations. And lastly, do not apply a tourniquet.
After a snake bitten, you will see a pair of punctured marks caused by the snake teeth, and sometimes the bite may be painless at the moment snake bite happened. While the venom entered the body, the casualty will feel severe pain, redness, and swelling at the bite. The whole limb may become swollen and bruised within 24 hours. Nausea and vomiting may also occur after the snake bite. Blurred vision, increased salivations and sweating, breathing difficulties, and sometimes may lead to cardiac arrest. To prevent venom spreading, you need to help the casualty to sit down and make sure he's comfort. Advise the casualty not to move his limb to prevent venom spreading. Apply a pressure bandage on top and extend the bandage as far up the limbs. If the bite is at upper limbs, immobilize the upper limbs by using a sling and broad bandage around the limbs and body. If bite at lower limbs, secure the lower limbs together with broad bandage and narrow bandage. Call 999 for emergency help and keep the casualty immobilized. Remember, do not apply a tourniquet or slash the wound with a knife or try to suck out the blood, because the blood contained with venom. And do not interfere the clothing around the bite. As movement increase, the chances of absorption of venom into the bloodstream will be increased.
Now, you already know how to handle a snake bite. But other than snake, sea creatures like jellyfish and corals are commonly cause stink to the people who swimming or diving in the seawater. Or you might also get stink while you are walking on the beach and not aware of they are just nearby. When the sea creature stung you, they will eject venoms, and this venom will carry stinging cell and will stick on your skin. Then you will feel pain, redness, and swelling. You might also experience nausea, vomiting, also headache after you get a sting.
Management to someone that's stung by a sea creature. First, move the casualty to somewhere safe and provide proper treatment. Your aim is to relieve pain and discomfort. You may encourage the casualty to sit or lie down. Then, flood the affected area in warm water about 40 degrees Celsius for 10 minutes. This will help to relieve pain and swelling. Send the casualty to seek for medical help. Remember, watch for any sign of allergic reactions, such as wheezing breath sound, and itchy skin. If any sign of allergic appear, you need to call 999 for emergency help immediately. For jellyfish stink, pour vinegar or seawater over the area. Then, this will help to remove or disable the stinging cell. Help the casualty to sit down and treat as snake bite, which is apply pressure bandage and immobilize the limbs. Call 999 for emergency help. Remember, do not pee on a jellyfish stink, because urine do not help to relieve the pain, and this also will cause the injury worse.
Here come to the end of these lessons, but before we leave, let us do some summarize of these lessons. If you see a casualties that with foreign object penetrate or dip in their eyes, ears, or nose, do not remove the objects, because this will cause more injuries to the casualties, and immediately you should seek for medical advice. And you know, poison can enter to our body in many ways. If you found a casualties with poisoning or suffering in poisoning, you should put on PPE to protect yourself. And if the casualty with chemical burn after they take poison or chemical splash on their skin, put them under running water for at least 20 minutes to cool down the burn area. If you see a snake bite, a casualty with snake bite, do not put a tourniquet. Here come to the end. I hope you enjoy these lessons. See you again. Bye.